Calcium. The normal range of calcium is about 8.5 to 10.5 milligrams per deciliter. Calcium is vital in regulating muscle contraction and relaxation, neuromuscular function, and cardiac function. A calcium imbalance is very important. Let's look at what happens when the calcium is high or low. Hypocalcemia, which is a calcium deficit. This is when the serum calcium is less than 9 or the ionized calcium is less than 4.5. Causes. One of the major causes of this is surgical removal of the parathyroid gland. Also, conditions such as hypothyroidism, acute pancreatitis, hyperphosphatemia, and thyroid carcinoma can also cause it. Another cause can be inadequate vitamin D intake, such as in malabsorption, hypomagnesemia, alkalosis, sepsis, and alcohol abuse. Clinical manifestations. Clinical manifestations could include paresthesia of the fingers and lip, muscle twitching, muscle spasms, and hyperactive deep tendon reflexes. It can also include a positive Chevitz and a positive Trosseau sign, decreased myocardial contractility, decreased heart rate, and hypotension. Laboratory findings can include a serum calcium level that is less than 9, prolonged QT intervals on the ECG. Nursing management. Nurses must monitor closely the respiratory and cardiovascular status of their patient. They also must protect confused clients by taking precautions. Administer oral or parenteral calcium supplements as ordered. When administering IV, monitor closely the cardiac status on the EKG. Nurses should also implement seizure precautions, encourage foods high in calcium, such as dairy foods and dark green vegetables. Hypercalcemia. This is when the total serum calcium levels are greater than 10.5 or an ionized calcium level is greater than 5. This occurs when calcium is mobilized from the body skeleton. Causes. Prolonged immobilization, having a condition such as hyperparathyroidism, malignancy of the bone, and Paget's disease, or excessive vitamin D intake. Clinical manifestations. Signs and symptoms could include lethargy, weakness, depressed deep tendon reflexes, bone pain, anorexia, nausea, vomiting, constipation, polyuria, hypercalciuria, flank pain secondary to urinary calculi, dysrhythmias, possibly heart block, and laboratory findings could include a serum calcium greater than 10.5. You could also see a shortened QT segment and shortened ST segment on the ECG. Nursing management. Nurses want to encourage their clients to increase movement and exercise. They also want to increase oral fluids as permitted to maintain dilute urine. They also want to limit their intake of fluid high in calcium and encourage ingestion of fiber to prevent constipation. Safety precautions for confused clients are important. It is also important to monitor for pathologic fractures in clients with long-term hypercalcemia. Encourage intake of acid ash fluids such as prune or cranberry juice, to counteract deposits of calcium salts in the urine. Now, let's go over some NCLEX style questions so that you can gain further understanding. Question number 1. All of the following except one are true about Trosseau sign. A. It is a sign of hypercalcemia. B. It can be elicited by inflating a blood pressure cuff on the upper arm about 20 millimeters of mercury above systolic pressure. C. It is described as an adducted thumb, flexed wrist, and metacarpophalangeal joint, extended interphalangeal joints with fingers together. Or D. None of the above. In order to answer this question appropriately, you need to know what Trosseau sign is. Trosseau sign is a carpal tunnel spasm which you can find in patients with low calcium and magnesium. This is caused when pressure is applied to the arm, such as when blood pressure is taken. So this question is testing your ability to find which answer option is wrong. In option A, it is a sign of hypercalcemia. This is not true. It is a sign of the opposite, hypocalcemia. In option B, it can be elicited by inflating a blood pressure cuff. Yes, this is true, because applying blood pressure to the arm can cause spasms. In option C, it is described as an adducted thumb, flexed wrist, and metacarpophalangeal joints, extended interphalangeal joints, with fingers together, this is the description of how the spasm looks, which is quite distinctive. And finally, option D, none of the above. Well, option A is an inaccurate answer, making this answer option correct. So the final answer is option A. Question number 2. The nurse receives the laboratory results of the client who had just undergone a thyroidectomy, and she notes that the serum calcium levels are 5 milligrams per deciliter. Which of the following signs and symptoms should she expect? Select all that apply. A shortened QT interval on the ECG. B, hypoactive deep tendon reflexes. C, seizures. D, lengthened ST on the ECG. E, lethargy. Or F, Chevick sign. When you are taking care of a patient that has had a thyroidectomy, it is important to know that a small percentage of patients who undergo this procedure have low calcium levels after the procedure. The parathyroid glands control the level of calcium in the body, and from the surgery, they could potentially be damaged. Hopefully, this damage is temporary, but in a very small percentage of patients, it is permanent. Usually, patients are instructed to take calcium supplements to prevent low calcium levels for a few weeks after surgery. In case that it happens though, let's go through these answer options one by one so we can see what would be expected. In option A, a shortened QT interval on the ECG, this would actually be seen in hypercalcemia. When the calcium levels are elevated, changes can be seen on the EKG, which can even look almost like a myocardial infarction. It is called an Osborn wave. In option B, hypoactive deep tendon reflexes, this is also more commonly seen in hypercalcemia. Option C, seizures, can be seen with hypocalcemia, making this answer option correct. In option D, a lengthened ST on the ECG, this is another change which can be seen on the ECG. So this answer option is correct. In option E, lethargy, this is actually seen in hypercalcemia. And finally, option F, Chevick sign. Chevick sign is a twitching response in the face after tapping over the facial nerve. This is also seen in hypocalcemia, making the final correct answer options C, D, and F, because all of these can be expected in clients with hypocalcemia. A, B, and E can be seen in hypercalcemia. In the next video, we're going to go over the electrolyte magnesium.